Thanks. Hello, this is Intan Fakori to discuss carpal tunnel syndrome and examination of the median nerve. This gentleman has a history of tingling and numbness, mainly involving the radial digits of both hands. He's been symptomatic for approximately 1 year, has paresthesia involving the radial digits of both hands as well as weakness. As you can see here, he has mild thenar muscle atrophy as well as in this area. The tendon that we want to test is the abductor pollicis brevis. That's purely innervated by the median nerve, and that's really the only one that is reliably testable for a median nerve problem at the level of the wrist. And the best way to do so is to keep the hand parallel to the ground and ask him to press against our finger. Okay. And he does have weakness. We can compare to the other side. He has similar mild thenar muscle atrophy. And this is a little better. The other thing that I would like to do to test the median nerve is to simply do what's called a compression test, to press about the same level, both sides, and see if they have tingling and numbness within 90 seconds. And then you can report it as a positive compression test after, let's say, 10 seconds, 30, 60, or 90 seconds. After 90 seconds, then it's negative. The others that you are familiar with is TNL, but it's really not very accurate, very specific or sensitive. And lastly is the phalanx. I know a lot of people try to press the wrists against each other dorsally, but really a more accurate way of doing so is just to allow gravity to press them down, and then again similarly weight, and see if they develop tingling or numbness, and then report it to how many seconds, 10, 20, 30, etc., and wait up to 60 seconds. And then also you want to just make sure that they have no other muscle wasting, such as a hypothenar or first dorsal compartment. Those are the ulnar nerve. And check the ulnar nerve by asking them to abduct the fingers really strong, real strong, strong. Keep them apart. Keep them apart. That's it. Keep them there. Okay, and strong. Similarly, keep them apart. Okay, strong. Okay, very good. And that's it. Continuing on with doing a cortisone injection for carpal tunnel syndrome. Remember, the median nerve is in line with the radial border of the ring finger. So if I may draw it, this is the median nerve. So our goal is to inject just ulnar to that, and between the proximal wrist and distal wrist creases. We use a little ethyl chloride and a little alcohol, and then nearly going perpendicular, and that's it. And then similarly we can do the other side. Okay, very good.